Very warm welcome to each one of you for yet another very engrossing session that we are going to be having shortly. We have numerous guests and very esteemed ones. And I'm not going to take any more of your time because we are, as it is going to be short of time today. So let me just begin by saying that the Global Research Forum on Diaspora and Transnationalism is a research and policy tank which is based in Delhi. Most of the people by now are aware of GRFDT because of the number of talks that we've been having on a regular basis with people participating from almost 50 countries, if not more. So without further ado, I introduce you to Professor Ali. Professor Ali is a professor of comparative African diaspora history. He's the dean and professor of Lloyd International Honors College, the University of North Carolina at Greensboro, US. Professor Ali is a historian of the African diaspora who explores the Atlantic and Indian Ocean worlds from the early modern period to the present. He was named the North Carolina Professor of the Year by the Carnegie Foundation. He has been a lecturer at Columbia University, a Fulbright professor at Universidad Nacional de Colombia, a visiting professor at Vanderbilt University, and a library scholar at the David Rockefeller Center for Latin American Studies at Harvard University. A very warm welcome to you, sir, and it's indeed an honor to have you amongst us. Over to you now, Professor Ali, and thank you so much for joining us.
Thank you, Dr. Sen. I really appreciate the invitation to facilitate this conversation with some wonderful colleagues and distinguished observers and guests. I will begin by saying that it's, on the one hand, I think people are a little zoomed out by the number of Zoom calls we're all doing. At the same time, it's a wonderful opportunity to connect. Okay, if people could please mute, that would be helpful just to reduce the sound. Thank you very much. So at the same time, this kind of platform has allowed for connections in new ways that are environmentally friendly and I think make it possible for us to quickly mobilize and connect with each other around important topics. So thank you for the organization's leadership in bringing people together and doing this. I will go ahead and begin to introduce our panel. I'll begin with Professor Thomas Feist. Professor Feist is Professor of Transnational and Developmental Studies in the Department of Sociology at Bielefeld University. His research interests focus on international migration, immigrant integration, citizenship, social policy, and developmental studies. He held visiting professorships at Malmö University and the University of Toronto. Professor Feist serves on the editorial board of the Sociological Quarterly, Ethnic and Racial Studies, Migration Letters, and South Asian Diaspora. Our next panelist will be Professor Margaret Walton Roberts. Professor Roberts is a professor of geography and environmental studies, Wilfrid Laurier University, Canada. Her research interests are in gender and migration, transnational networks, and immigrant settlement. Her current research focuses on gender and the international migration of healthcare professionals and international student migration. Next, we have Professor Pushpendra Kumar Singh. Professor Singh is professor and chairperson of the Center for Development Practice and Research, Tata Institute of Social Sciences in India. Previously, he was director of the Center for Social Studies in Surat, India. He was a visiting fellow to Asia Research Center, London School of Economics and Political Science. He also served as the Dean of the School of Rural Development of TISS. Mr. Jean-René Bilongo. Mr. Jean-René Bilongo is head of Migration Policies and Inclusiveness in the Department of Italian Agri-Food Union. It's FLAICGIL, a long acronym. He is coordinator of the P. Risotto Observatory. Mr. Belongo is currently looking after the legalization process of undocumented migrants in Italy, for which he has been advocating since quite a long time. Next, we have Mr. Kwando Boakie Yadom, is a managing co-partner of Migrant Watch and Skilled Revolution Front in Ghana, West Africa. The MWSRF, as it's called, is a civil society organization governed and managed with a passion and vision to fight against poverty, injustice, and illegal migration in Ghana. The organization's recent project involved working with the IOM and the European Union to assist rescue about 180 Ghanaians that were enslaved in Niger on promises of better jobs, something we've been seeing. And lastly, we have Mr. Shabari Nair, is a labor migration specialist for South Asia, ILO Decent Work Technical Support Team in New Delhi. He provides technical advisory services to 7 countries in the sub-region. Prior to joining the ILO, Shabari worked with the Swiss Agency for Development and Cooperation, the SDC, Federal Department of Foreign Affairs, Government of Switzerland. So these are our panelists, and the topic that we're here to discuss, have conversation, is return and integration challenges of migrants during and post-COVID-19. Again, so just that we're very clear about sort of the general topic, it's return and integration challenges of migrants during and post-COVID-19. So if we may begin with basically what I would like to do and is have everybody say, take 2 minutes. And I'm one of those moderators that does not have an issue with cutting people off, because I know it's in the interest of the collective to do so. So we'll go through 2 minutes, and I will gently urge you to wrap up if you go beyond that. And I'd like to ask you, what is the most important thing for us to understand from your perspective, from the work that you're doing? What is the most important thing for us to understand from your perspective regarding this issue of return and integration challenges? And what is a solution that we can begin to affect? Okay, so what is the most important challenge and what's a solution we can begin to affect? So this is in some ways a challenge to do in 2 minutes, but let's begin. Let's have people take begin this, and then we will be able to continue with the conversation. Does that sound good? Yes. Do I get a thumbs up from everybody? A nod? Okay, very good. Thank you all. Okay, so let's just go in the order that I introduced our panelists. Professor Feist, if you could unmute yourself, and the floor is yours at the moment.
Okay, thank you for inviting me and having me. I want to start with 2 claims. The first one is that it doesn't make a lot of sense to me to talk about the long-term effects of COVID-19. I think that's pure speculation. I think the most important point is to ask, what does the pandemic really reveal about the normal functioning of migration regimes? And I think that return policy, that's the second claim, needs to be complemented by considerations of migration as circularity and transnationality. Otherwise, migration is simply a linear event. And what is the most important challenge? I mean, beyond these conceptual considerations, I think it's really, if we look at return, the destabilization and the economic destabilization of some of the countries of origin. In Europe, for example, if you look at Bosnia-Herzegovina, you have a lot of return right now from all over Europe to this country in the Balkans. And it's destabilizing an already weak economic situation. So I think it is really a very deleterious and very negative effect. That's the first challenge. The second challenge and the solution, I think if you look, for example, at return migration, forced return, but also more or less voluntary return from Germany to African countries, North Africa, Mali, West African countries, we see that if return migration cannot be planned, by the migrants themselves, as it is now in the pandemic, it has very negative effects on the prospects for reintegration. So what is one of the solutions? I do think that countries like Germany, European countries more generally, really need to negotiate with the countries of origin more comprehensive packages and not just force them to readmit migrants whose asylum claims were rejected. So I think there needs to be a combination of readmission, return, but also prospects and gateways for legal migration. So I think in this comprehensive way, we find more of a solution. And also, I think that civil society organization and sponsoring civil society organization makes sense because they're the ones in the European African context which really help to make sure that negative effects are caught early. So these were my 2 minutes. Thank you.
Thank you so much, Professor Feist. Next, we'll have Professor Margaret Wallen. If you would please unmute.
Yes. Thank you very much again for the invitation to be part of this panel, and it's wonderful to see so many friends and colleagues. So I do enjoy these Zoom opportunities. Thank you, Professor Ali, for your comments. If I'm allowed, I'll just make the 4 main points that I had identified as being relevant to what I wanted to say. The first one was, we absolutely have to understand the diversity of migration that we're talking about here. So it's an enormous issue. We have to think about diversity in terms of geography, where people are coming from, where they're going from. 2, the time involved. Is it seasonal? Is it circular? Is it permanent? The scale, the magnitude. And of course, in the case of India, this is the idea of internal migration and international migration. And also regular and irregular. And so there's this sort of immense complexity informs the conditions of migration, our knowledge of the magnitude involved, the migrants themselves and their experiences of migration and return, and of course their treatment by government and by local authorities and communities. And so there's an immense complexity here that perhaps that's not fully recognized by the various organizations involved, the public and the media. Okay, somebody needs to mute their microphone. The second point is the integration, understanding the integration, especially of lower skilled migrant workers, especially internal, and how that depends on the role of local organizations and activities. And as Thomas Feist mentioned, I mean, really thinking about civil society here and thinking about how those organizations can be best supported through central government commitments. In terms of international migration, we've been seeing significant news media coverage of India's, the workers in the Gulf, and before the meeting, we had a lot of people discussing this in terms of different experiences occurring in many of those Gulf countries. And I would also concur with Thomas Feist's comments that what we really need is much more coordinated national action here. Again, we need to see a much more committed engagement to planning and understanding the responsibilities of different governments here. And then finally, I think an important solution in many ways is that we need more timely data to be gathered. It's important for policy access, for policy action. But the problem is, even though, especially in the state of India, there has been significant data collection, making that data accessible in a timely manner for policy decisions to be made and for researchers and local organizations to use it has been highly problematic. Thank you.
Thank you, Professor Walton. Next, we have Professor Singh, if you would kindly unmute. Professor Singh, we can't hear you. Let's see. Okay. While Professor Singh perhaps is working on technology, let's go on to Mr. Bilongo. Mr. Bilongo, would you kindly unmute?
Well, can you get me?
Yes.
Hello? Hello.
Yes, Mr. Bilongo, thank you.
First of all, thank you for the kind invitation to this webinar, very interesting webinar with a very rich panel. Well, for my first 2 minutes, I would say this. Our organization, the organization I work for, believes that migrants are free to get back home during an emergency, during an outbreak like COVID-19. But at the same time, those who cannot move freely from their host country to their home country really deserve more attention by the local state, the local authorities, the government. And that's why, for instance, in our case, we organized a very strong campaign, advocacy campaign, claiming for legalization act, an amnesty for undocumented migrants in Italy. And we really got it because we cannot force anyone to move from one place to the other with knowing that he might not have the opportunity to come back to the place we were living before due to the fact that he might be undocumented. And we believe documents, the government should legalize their position, and we got it. That's our position from that standpoint. Thank you.
Thank you, Mr. Belongo. Is Professor Singh available now? Professor Singh? Okay, let us go now to Mr. Yadom. If Mr. Yadom would kindly unmute, we'd love to hear from you.
Okay, thank you, Professor Ali. Thank you, GRFDT, for these sessions. I think they are very much needed, especially in these times. The main things that I would like to talk about has to do with migration in the Ghanaian context. I would like to touch on issues faced by legal migrants abroad and the efforts made by the Ghanaian government to facilitate some return and the challenges with that. I would also be talking about the seasonal migration from Ghana and other neighboring West African countries through the Sahara Desert over to Libya, Algeria, and then onwards through the Mediterranean to Europe, and the current challenges that the coronavirus pandemic has presented to these vulnerable migrant groups. And then lastly, I would be touching on a category of Ghanaian migrants that have been lured into some abusive domestic work situations in the Gulf states, with promises of some lucrative jobs that don't pan out. And we've heard a lot of stories of abuse of these vulnerable people. And in times like this, these people have no means to return. So they are really helpless, desperate, and in need of a lot of support. So in terms of solution, some of the things has to do with the government actually stepping in to do more. We've seen some action from the government. We would like to see more. And also, in terms of the humanitarian situation that's currently ensuing in Niger, we would need to have parties like the UN, IOM, and countries of origin to collaborate, cooperate, and mediate some kind of international, humanitarian corridor for aid, and then to facilitate return of these people to their home countries, as their situation currently are very perilous. So I'll end my 2 minutes here for now. Thank you.
Thank you. You've all been really wonderful in terms of giving expression to what the challenges are and what some possible solutions, directions within 2 minutes. It's remarkable. Thank you all. So Mr. Nair, if you would kindly unmute, we'd love to hear from you now.
Thank you very much, Professor Ali. Such a pleasure to be here, and thank you to the GRFDT team for having me on board. You're all academics. I'm a policy guy. So let me come at it from a very policy-oriented perspective. On the 28th of May, there was a flight that was coming back from one of the Gulf countries to a country of origin in South Asia. And on this flight were 275 passengers. These 275 passengers, this was from a news article published, were divided. The journalist has covered these 275 passengers across. He's kind of made a clear distinction as to who, what profiles they carried. 26 of them were inmates. They were in prisons. 5 were safe house inmates, which means 5 of them were in embassy shelters. 17 were pregnant women. 19 were visit and short-term visa holders. And 206 were migrant workers whose jobs were terminated or who had resigned. That, for me, is a profile that is important for us to keep in mind, because the challenge in reintegration will be to understand how each one of them need to be addressed at their respective levels. So that, for me, is priority number 1. The second is this: why do people migrate in the first place? They're migrating because they're going for a better economic opportunity. They're going to put bread and butter back on the table for their families back home. In one of the last GRFDT conversations, we heard that in one particular country in South Asia, in April alone, remittances had dipped by 32%. So 1/3 of the remittances of that country had come down by 32%. If that is the case, we need to look at this conversation even in terms of making that link to wages. How many of these people have lost wages? And if they are coming back, what is the access to justice that needs to be provided, a transitional access to justice that needs to be provided for these people who have already paid a lot of money to migrate in the first place, and now have to come back, leaving their jobs behind and their families in even more vulnerable situations than when they first left. I'll stop there. 2 important policy points for us to consider, and we'll take it in the rest of the conversation. Thank you, Professor Ali.
Thank you, Mr. Nair. Professor Kumar is actually now on. He was having some electricity issues. So thank you very much for your persistence to get on. Professor Singh?
Thank you, Professor Ali. Sorry for this electricity outage. My first point is that what is very important before we discuss integration is the point of the issue of return. Whether these migrants are really coming back, how many of them are actually coming back. In India, if you look at the data which we have, the government has started with 15,000 people in the first phase. Now they started second phase, then additional second phase, and then they are saying that the phases will be extended up to early July, and the total number of people which the government intends to bring back, that is something between 225,000 to around 250,000 people. Now, if you look at within this data, how many will be laborers, then my hunch is based on the countries where these migrants have gone, those who have gone to immigration check required countries, then the total number of people who are going to come back are likely to be less than 90,000, or that 90,000 may be the upper limit. And within that 90,000 are generally those who are in a position to pay their ticket prices, and those who are able to influence the government, the missions, Indian missions abroad. So those people will be coming. So first thing I find that the government is either very cautious, or the way we have seen within India, the government has no intention to bring back its people. So in that case, I think the focus should shift on the issue of the condition of migrants at destination. So what's happening to them? We know that there are certain sections of migrants who are very vulnerable. Those who have taken, those who have gone to Gulf countries for the first time, or ECR countries for the first time, those who have paid a heavy amount and perhaps borrowed money to pay to the agents. So what's happening to them? Those who are living in, say, labor conditions, or in those occupations which are like low-paying occupations abroad. For example, if you look at the 5 top say occupations in which Indian migrants are employed. These are the labor, mason, helper, carpenter, and driver. Obviously, these are low-paying jobs. It takes years to actually to repay the loan which normally the migrants take to go abroad. So what's going to happen to them, and what's happening to them? Those who stay in, say, small rooms sharing with 6 to 10 or 15 people, those who don't have running water, those who don't have even private toilets or say bathroom, or those who depend on outside for eating out. So my point is, if the government is not willing to bring back the migrants, then the focus should shift on the condition of migrants at destination, and where I find very little literature. I have scanned through various journals, various newspapers, Gulf newspapers, but there is very little about what's the condition of Indian migrants there. And if we are able to deal with these two issues, in that case, I think then we need to discuss what is going to happen to those who are planning to come back, or those who will come back. Now, we don't have much information about the occupation of those who will come back, because I don't see that information collected in India. So, but presuming that these people are coming back with the same kind of occupational background, in that case, I would say 50% will be from Kerala, because I have looked at the flight schedules, and it shows that more than 50% will be coming to Kerala, and less than 50% to other states. There also Telangana, Tamil Nadu are going to dominate. So what I'm saying,
yes, yeah. Professor Singh, if you could kindly wrap up.
Yes. So what my point is that these people can be definitely accommodated in given their occupational background in the Rural Employment Guarantee Program, or if there is a counterpart of Rural Employment Guarantee Program in urban areas, which at present is not there in India.
Thank you very much, Professor Singh. So let's go back to give Professor Feist, who went first, an opportunity to perhaps build on what our colleagues are saying they see as particular challenges and directions for solutions. Professor Feist. You need to unmute. You need to unmute.
So let me just continue where Professor Singh left off, namely the issue of integration. And I think when we talk about return and integration, integration is almost an impossible concept. It's very chaotic with lots of different meanings to everybody, right? But I do think that maybe one could agree to say that integration needs rights, social rights, civil rights, let's say the right to a fair and decent wage. And it needs some kind of structural integration into the economy, into the schooling system, and it needs a sort of a dimension of recognition. All of these three are needed. And let me just explicate that with a European example, what it's about. When we turn from return, we could also, when we talk about return, we also need to talk about circularity, many returns and comings, for example, because many workers and many migrants are those engaging in circular patterns of mobility, and also transnational ones. And I think that when we look, for example, at the meatpacking industry in Europe, looking at Romania and Germany, the pandemic raises issues of integration in very, very detailed ways and very important ways. Namely, when you look at meatpacking in Germany, where Romanian workers are used, who are engaged in circular migration, you can see that during the pandemic, the usual occupational safety and health conditions become even more obvious, because these workers are employed by subcontractors or subcontractors. And they often do not receive a decent wage. They often are kept in overcrowded and unsanitary conditions. And that's not integration into the European or German labor market. These are not third country national. These are EU citizens, the Romanian workers. So it's not simply a matter of citizens and non-citizens when it comes to integration. It's really a matter of what kind of rights they have. And what happened in this case a couple of weeks ago is that when Romanian workers were kept in these unsanitary conditions, COVID-19 spread among them. Hundreds of them, thousands, got sick. And they returned to Romania, where they usually live, to their families, importing, so to speak, to Romania in remote parts where SARS-CoV virus was not existent, this virus. So you can see that this kind of integration challenge is one which takes place both in the country of immigration and in the country of emigration. In both of these places, there are integration issues, and they can only be addressed if there's a modicum of rights and these rights are enforced. Unless that's the case, I think we cannot speak of meaningful integration in terms of rights, in terms of structural integration into employment, for example, and in terms of the recognition of the basic needs of these migrant workers. That's why I think this integration challenge is one which needs to be thought beyond a kind of a national container and needs to encompass the whole corridor of migration, the whole transnational space of migration. So the question is integration into what? It's not just at the return, it's also on the other side. Thank you.
Thank you, Professor Feist. I want to maybe ask Professor Walton, you had mentioned that in some ways, one of the 4 points that you made about the civil society and how to really mobilize that sector in terms of organizations, that I took it to mean not necessarily part of the government, because when we're talking about rights and enforcement, this seems to be more of a governmental issue. But I think people also enforce in the non-government sector. But maybe you could speak a little bit about that second point and any other thing that you would like to build on what Professor Feist is saying. You have to unmute.
Thank you. Yes, thank you. A few things I was thinking of. I would agree that the issue of integration is very much about rights. And of course, again, that speaks to the diversity of those who we consider migrants, because the right of the migrant is wrapped up in all of these issues of diversity, the occupation, the status, the location, where are you moving from, where are you moving to? And so my own research has looked at international health worker migrants as well as international students. And of course that, again, there's an enormous complexity within that. So I could talk about that and then maybe say a word about the civil society issue, if that's okay. I mean, some of the interesting things I've been paying attention to, of course, is, and I would concur that it's difficult to try and plan what the long-term consequence of COVID-19 is going to be beyond the enormous disruption that we have witnessed and experienced. But certainly healthcare worker migrants have become really visible during this crisis. And countries such as the UK and the USA and my own country, Canada, people have become much more aware of the fact that their healthcare systems are staffed by a globally sourced labor market, a labor supply. And so those workers are most likely not going to be subject to kind of return because their skills are highly required now. Although I would say there is some concern still about their ability to have those rights that allow for integration in the source country where they are. And we've seen some of those debates with the NHS. Within, though, healthcare workers, one group that is perhaps more susceptible to this disruption linked to COVID is the international students. So India, for example, about 18,000 Indian students are studying in China and Central Europe. Many of them are studying for medical degrees. The likelihood of their studies being disrupted by this and then having to return is more likely. And of course, their integration will be very difficult because they are already getting their credentials in other places, and the Indian government doesn't necessarily recognize those credentials. So you'll have a group of young people, primarily young people, whose career development will be truncated. And so how how will those individuals manage if they are forced to come back? And then this speaks somewhat to those local civil society institutes. So certainly we have heard about the important work that's been done by panchayats at the local level, and we've heard about some, stellar evidence of kind of disaster planning and relief that's occurred within Kerala, especially women's organisations. So at the local level, especially for the sort of the less skilled internal migrant workers and others, I mean, this provisioning of basic, food and shelter and organising a humane system of quarantine is absolutely necessary, and has sadly not been fulfilled in an adequate, coordinated manner in many examples within India. But we are seeing some work done at the local level by those institutions. And so certainly in terms of the state and forms of governance, this is where they need to direct some of their attention in the immediate response, and probably in the longer term as they deal with this significant disruption to labour market experience.
Thank you, Professor Walton. Mr. Belongo, I was hoping you could come back into the conversation. You were speaking about advocacy and the issue of basic laborers, and maybe you could expand on what Professor Walton is bringing out. Mr. Belongo, you need to.
Okay, thank you. So let me start by raising one point. The coronavirus outbreak showed an evidence. Considering migrants from third world countries, we noticed that on the way back home, in the attempt to get back home, most of those migrants in almost all the countries of the world were forced to coercive confinement. As they reached home, they were forced to coercive confinement based on the fact that they were believed to be carriers of communicable and lethal disease such as coronavirus. And in this case, these migrants ceased to be considered as sources of GDP increases and remittances, etc., etc. Now, we believe that based on that and the fact that at the national level we are in Italy, we work in Italy. At the same time, at the national level, for instance, in Italy, the undocumented migrants really had no attention from the authorities. I mean, undocumented migrants have no rights. They are not recognized as persons. They are not recognized as carriers of rights. And based on that, we initiated a very, very hard campaign, advocacy campaign, asking the government for an amnesty to legalize their position. Why? If we consider in Italy, we have about 700,000 undocumented migrants. It is not the 700,000 people, the number is not too high, but at the same time, 700,000 people are huge, And if we consider the fact that most often they live in very miserable conditions due to the fact that they're exposed to exploitative labor, very low wages, and so on and so forth. We believe that the best way to get out of that condition was that of granting a residence permit to all those migrants, the undocumented migrants, because the first, so that they can first of all have access to medical care in case of infection, because undocumented migrants normally feel scared to get to public hospitals in search of if they are in need of health assistance. So the first thing was that of recognizing their position in the country, that they are they are in the country, and legalize their position. At the same time, what happened here is that workers from Eastern Europe, we are an agri-food labor union. Workers from Eastern Europe, I mean, from Romania and Bulgaria, when the outbreak started in Italy, most of these workers went back home. No, they went back home, they went back to Bulgaria, they went back to Poland, they went back to Romania. And the emergency, the outbreak also was there. So there was no way to come back to Italy to fill their position. And we had a shortage of labor force. We have a very huge shortage of labor force in Italy. And together with our campaign, the government decided to legalize the position of undocumented migrants. And the amnesty is also a very strong way to promote inclusiveness and integration, because we cannot continue to believe that some people may be excluded from the society, even though they contribute to the welfare of society, even though they contribute regardless of their condition, because any one of us contributes to the GDP, any one of us contributes to the to the welfare of the national economy. And we cannot continue to consider those people as if they should be, they should be excluded from forever from interacting with the society. That's the aim of our advocacy. It was not easy. It was a very long process. We had to involve all the huge NGOs of the country. We have to involve top civil society leaders. We have to involve influencers, writers, journalists, top university lecturers, clergymen. We have to involve clergymen. We have to involve so many people, as well as common citizens. We have to involve universities. We have to involve a very large range of people, organizations, and institutions to support our advocacy. We published the appeal. We wrote an appeal, a letter appeal. That's how we call it in Italian. A letter appeal to the head of state, to the prime minister, and to the government. To consider the situation of these undocumented migrants. Most especially in agriculture, in the agri-food sector, we had another fact. People were forced to remain at home, and somebody should work in such a way that this food security of those people at home should be guaranteed. And who was performing that work? Undocumented migrants. So we just raised the point that they should be considered as heroes, because working and living in those conditions with the coronavirus outbreak, they have to be considered heroes. And the only way for the society and the institution to recognize them as heroes was to legalize the position, was that of an amnesty. And it is currently going on. It is already 9 days that have been going on. It is going on.
Thank you, Mr. Belongo. I think they are heroes indeed. I agree with you full-heartedly. I think that this also speaks to being attentive to the diversity of people that we're talking about, and also in some ways the diversity of solutions and sort of people that we need, and organizations we need to bring into the fold. Let me turn things over to Mr. Yadon, who has been discussing, the context of Ghana, and maybe you could elaborate a little bit on some of these points that were being made.
Thank you, Mr. Moderator. On a day like this, when we talk about the situation of migrants, we would be very remiss if we fail to acknowledge the impact of generations of forced migration and the ongoing worldwide protests regarding racial inequality and police brutality. Our organization, our thoughts are with and prayers are with the family of George Floyd and countless others before him. And we solemnly hope for longer lasting reform on fundamental human rights and equity. That said, I'd like to segue into the points that I raised earlier. On May 12th this year, the Ghana Ministry of Foreign Affairs and Regional Integration published a request for information on Ghanaians and legal permanent residents who were stranded abroad as a result of the closure of international borders, right, to contain the pandemic, to make their information available for possible repatriation back to Ghana. The conditions, though, were that they needed to pay for the cost of travel back, and also they were given 24 hours to make that information available. While this was a step in the right direction, it immediately excluded certain categories of stranded migrants. The first category being people who couldn't afford the cost of transportation back, and people who may not have even heard about this request for information, since it was the deadline was over in 24 hours. Even for those who had resources to go back home and had received this information, there was no mention of any reintegration plans. And that makes it a very difficult decision to go back on in a local economy that they had left for so long, and with the plummeting jobs in this pandemic, that actually makes that decision very difficult. On irregular migration in the wake of the pandemic, Niger is a country that has long been a transitional corridor for informal and seasonal workers from Ghana and neighboring West African countries, heading to Libya, Algeria, and onwards through the Mediterranean Sea to Europe. With this ongoing pandemic and the stringent border protection measures, we are seeing a pushback operations happening between the border of Niger and Libya, where convoys of migrants are intercepted and sent back in the middle of the desert. Later in March this year, there was a convoy of pickup cars carrying about 256 people, including 53 Ghanaians, 104 Nigerians, and 34 Burkinabes that were pushed back by Libyan militiamen close to Tumo, one of their military outposts bordering Niger and Libya. Now, these people began their perilous journey back to Niger in temperatures in excess of 120 degrees Fahrenheit for days before receiving humanitarian aid from IOM and Niger's Civil Protection Department that organized their transfer to Agadez. Each one of these people required a 14-day quarantine in efforts to contain the virus, and they had to be housed in makeshift tents in these harsh conditions. We do appreciate the effort that the IOM and certain parties, including the EU, have made to provide humanitarian aid to these people. We've also seen this Doctors Beyond Borders, the Red Cross, all providing humanitarian aid. But as things stands now, the situation out there is really perilous, with IOM reporting assisting over 700 stranded migrants. What is missing from this picture is the impact or the action from governments of the countries of origin to actually try and facilitate the return of their nationals back to their countries of origin. IOM is carrying out some voluntary return for migrants that have completed the 14-day quarantine and want to go back home. They talk about the assisted voluntary return and reintegration program that offers counseling, transportation, and some reintegration package. But there is the need for government and civil society to step in and increase and extend these reintegration efforts for a more sustainable and longer lasting situation, that we don't have these guys going back on these perilous journeys. On the other extreme, we also, like I mentioned earlier, that we need to work with the UN and these countries to develop these humanitarian corridors where we can actually, in the ongoing border lockdowns, to arrange for aid, and also to facilitate the return of these stranded migrants back to their countries of origin. Finally, I would like to touch on this situation with Ghanaian domestic workers that is currently ensuing in the Gulf states, including Kuwait, Oman, Qatar, Lebanon, UAE. We have over 2,000 young Ghanaian women that are stranded in the Gulf in abusive domestic work situations. That is really akin to slavery. In June 2017, the Ghanaian government placed a temporary ban on recruitment of workers to the Gulf states, citing a hike in reported cases of abuse faced by migrant workers. Unfortunately, this did not stop such migration, and abuse of these domestic workers continue. There are some nefarious actors that lure these people on these trips for their own parochial interest. The bottom line being that these Ghanaian domestic workers are being abused. They are currently helpless with no means to return. And even in a situation like this, where there's a global pandemic, these people are most vulnerable in terms of their living conditions. And with no means to return, they feel trapped, they're helpless, and very, very vulnerable to the coronavirus. So definitely and more urgently, something needs to be done. And we propose that government and civil society take active steps to negotiate the return of these vulnerable group. So thank you.
Thank you, Mr. Bouakid Yadoum. Mr. Nair, as you describe yourself as the policy guy, how do you see what is being spoken about here in terms of policy and ways of understanding how to change things?
Now, very good question. I'm glad you put it along those lines. So let's look at it this way, and I'll speak for the South Asian context, keeping in mind what most of the other speakers have now mentioned. South Asia has 8 countries. Now, out of these 8 countries, 6 of them are active labor sending countries. So there is a global estimate of 164 million migrant workers in the world. Out of these 164 million migrant workers, close to 50 million migrant workers come from just these 6 countries. Now, that's a big amount, keeping in mind the fact that that is, over 1/3 of the global migrant worker population come just from South Asia. Now, within that context, if migrant workers have to come back, and we know that most of the migration flow from these 6 countries are to either the Middle East, Southeast Asia, or within the region. And that is all in the route of temporary labor migration. So when people move on temporary flows, there has to be that immediate understanding that they will return. So with that in mind, do governments then have policies? I mean, if you talk about perspectives of return migration, that they will come back because it is a temporary migration flow, do governments have policies in the region? Not necessarily. Not necessarily. So perhaps that has been one of the biggest gaps that we have seen at the policy level in South Asia. Is out of the 6 or out of all the South Asian countries, there is only one country which has a solid policy on reintegration, and that is in Sri Lanka. Now, this then leads us to ask, what kind of policies do they have in place in general, looking at the broader issues of reintegration? Take, for instance, apart from the fact that there is a reintegration policy, a lot of the countries have jobs policies, have employment policies, have issues pertaining to livelihoods, and have policies on all these various different aspects. In quite a few countries, when migrant workers come back, they are not considered to be of a status where they can access, let's say, services that are applicable to nationals in those countries who are below the poverty line. Now, that's already an integral problem. It's a problem in the sense that a lot of these people are viewed to be better off than people who are in their countries of origin. Now, that is a perception that has gone totally wrong. So if migrant workers are not able to access those services at the local level, then that is an issue as well. The third element in terms of the broader policy issue is, and I appreciate how Dr. Margaret Walton Roberts put some of those elements together, going right down to that panchayat level or the local level in some of these states, as we call them in India. When you go down to the local level, then you start making the link top to bottom up in terms of the coordination at the whole of government or through the whole of government approach. The coordination is perhaps very, very difficult. And that is because it also includes, coordination includes sharing of information between the different ministries involved, between central government and state government, and amongst local authorities within the different states as well. So when somebody comes back to a country, I am an Indian national. Let's say I was living wherever in the world and coming back, I'm not just coming back to my country, I am going down to that village, that community that I come from. And there is a local self-government that is involved there. So it requires a whole range of coordination between and in this whole of government approach that requires for us to take things forward at the policy level for reintegration to truly be efficient and successful. Thank you.
Thank you very much. And let's go back to Professor Kumar. And it's right now, we've just over under 1 hour right now. I do want to leave some time for those who are part of this call to be able to ask some questions. So let's go to Professor Kumar, and then we can maybe hear from a couple of you who've been referenced in the conversation so far in terms of follow-ups, and then we'll open things up. Okay, so Professor Kumar, if you would unmute yourself.
Thank you. From the Indian perspective, I think for integration, the Indian state has to be the primary duty bearer. If you look at the migrants who are coming and to the places where they would go back, I think there are differential capacities. So migrants, if you talk about how they can integrate themselves, they have differential capacities. Also the provinces, because we have a federal structure, so the provinces also have differential capacities. And then the civil society also in different states, they have different capacities. Now look at the overall situation. Before COVID, India was experiencing very high level of unemployment. In fact, just before, say in 2019, we got the first the survey report of periodic labor force survey, and which said that India was at the level of the unemployment rate, which was highest in last 45 years. Now, after COVID, the report suggests that we have lost more than 100 million jobs. That means those who are coming back, they have to also compete with the locals, those who are migrants or those who are not migrants. But because there is loss of job, so they have to compete with people here. That's the first major problem in this integration process. Then states like Kerala have better capacity to deal with the returnee migrants, which the four, I think, top sending states of UP, Bihar, Rajasthan, and West Bengal, they do not have that capacity. Okay, so and then if you look at the civil society, so for last 5-6 years, there have been attempts to completely to make them run out of money. So there are so many changes in legislations and rules, so that the source of funding of civil societies have almost dried up. It has reduced to less than 1/3 what it used to have been in the past. So their capacity to help people is really, really limited. Now, in this situation, if we are working on integration, then integration is likely to be really difficult. Now, look at but still, what are the opportunities? I have already discussed the the work profile of the migrants. So if I consider that those who come back and they have the same work profile, in that case, because largest number of migrants from India are in construction industry, so maybe work program are going to be major help for migrants, both internal, because internally also more than 50% migrants work in construction industry. So work program, work expense, that has to be expanded. We have at present only rural work program, which is called Mahatma Gandhi National Rural Employment Guarantee Program. Can we have similar program in urban areas, which can be used as wage subsidy program to also help revive the medium and small scale industry, so MSMEs. So if that can happen to some extent, that will generate employment. And at this stage, India requires massive investment in these work programs, and both for the local say workers, the internal migrants, and also international migrants. Then we require large scale direct income support. And at present, what we see that there is huge package announced by the government, which is almost up to 10% of the GDP, but it's not income support program, it's basically loan support program. And these are mostly in the form of loan guarantees. So we require income support program, which is at present very meager. And then we also, for integration, we also have to ensure that generally what happens in any epidemic or any disaster situation, that all the, say, your pre-existing inequalities, pre-existing bias, pre-existing discrimination, and also your all the fault lines, they also get magnified. So if you look at caste discrimination, if you look at the discrimination on the basis of religion, all these are more active at present than pre-COVID situation. So we also need to deal with these situations. Without that, just economic package or just some job is not going to happen, because then there will be discrimination. Who will get the job? So we need to also deal with at that level. And then we also require psychosocial support. That's also important part of any integration program. And then finally, I would also say that what about those who are very vulnerable, those who migrated for the first time, those who have borrowed money, how those are going to be compensated? We have to think about those people also who are more vulnerable. Now, I don't see at present any integration plan of the government. And as I said, without Indian state, integration is not going to be possible. Thank you.
Thank you very much. Okay, so there are several questions that have come up and in the chat, and I wanted to just be responsive to those of you who took the time to ask those questions. And I'm going to turn to Dr. Roberts here. One question that's asking about issues of gender, and I think that it hasn't been raised so far specifically here, is most of the workers engaged in domestic work or healthcare are actually women. Do you think that women are disproportionately affected more in comparison to men? If yes, what can be done to counter this? So Professor Walton, if you would kindly.
Thank you. Yeah, I see that question from Emma Rilda. Thank you. Yes, gender is obviously a significant dimension of what's happening. There is an interesting gender working group in terms of COVID-19. They've been paying attention, of course, to the infection rate of COVID, which has apparently been more significant for men. But of course, women are disproportionately represented in many of the front line of the healthcare workers. So 80% of nurses tend to be are female. In Canada, we have had the epicenter for the COVID-19 infection has primarily been in long-term care homes. And those long-term care homes are staffed by predominantly women and significant numbers of immigrant and racialized women. And we've had some very interesting cases in Quebec, for example, where we have had refugees who walked across the border at Roxham Road. So when Trump was bringing in he's a kind of was causing all the disruption in terms of the rights of asylum seekers, many of those individuals in the US walked across the border into Quebec, across unmanned points. Some of those workers, especially Haitian women, ended up finding work in some of the long-term care homes in Quebec. And in response, there's been huge public support to seek a fast-track asylum, but a regularization of those asylum seekers because of the work they have been doing in those frontline long-term care facilities. And so that's a very interesting example. If I may just take this moment to speak very quickly about the issues that are coming up in terms of issues of rights, and talking about, as Professor Face did, about integration and rights. And also, I really do want to kind of follow up on many of the speakers talking about the fact that we are witnessing in this turmoil, just south of the border to me, but also worldwide, the protests about Black Lives Matter. And that is an example of how it is not clear that when you are supposedly have the rights of citizenship, you don't actually get to access those rights. And so just as African-American communities are demanding that systemic racism be seriously taken to task through policy measures, I would say we can also see that quite clearly in terms of the experiences of internal migrant laborers within India, and that this issue of solidarity and rights and being able to demand that your state provides to you the basics and protects your life, that has not been clearly evident. And I think it highly reflects this issue of the complexity of seeking rights. It is not a binary. Citizenship is not a binary. As much as legal scholars might say you have it or you don't, the reality is you only get it if somebody recognizes you as having it. And you have to enforce that demand that you receive justice and protection, as is your right. And if the state bodies are not willing to do that, then you have to find ways to either protest, or you have to have advocacy networks work on your behalf. And so I think that's another issue that seemed to be coming up through many of the comments shared by the co-panelists.
Thank you very much for that. I will go ahead. There's a number of questions there. I want to perhaps go to Professor Face. There's several questions that were directed towards you. Let me take a look and see. I'll take this one here. Professor Face, I would have a reservation on using the term forced migration in this case, they say, as probably there are conceptual differences with the classic one. Don't you think we could think about applying a different term in this regard? And I think this speaks to some of the legalistic ways in which people kind of categorize people when on the ground. I think that many of us would agree that everybody should be extended those same rights. Professor Face, would you please comment? Unmute, please.
If we lived in an ideal world, of course, all citizen rights would be human rights. And that would be the most ideal world we can think of. But it's not like that, of course. And I think that by using terms such as forced migration, not with respect to any kind of migration, but to migration where we know that people are not simply forced by political persecution or by generalized violence, but also by economic hardship, by kind of famines to move, I think then the term is more than justified. So I think that forced migration is an umbrella term, which does not apply to all kinds of migration, but to a significant part in between more voluntary labor migration and migration evolving out of generalized violence. And that's why I connected, or perhaps used this term forced migration when I talked about asylum seekers from some African countries to destination countries such as Germany. And this kind of setup, I think, leads us to the point how do we address policy-wise the effects of rights and rightlessness? As Margaret Walton-Roberts has pointed out, citizenship is not a binary. And I also said that, for example, Romanian migrants who should have the same rights as German workers do not have them because they cannot enforce them. But what is policy to do? And here I want to come back to something Mr. Bilongo said before. He mentioned the case of Italy, where the Italian government is considering to extend an amnesty to legalize many of the undocumented workers. And I, of course, would wholeheartedly agree so that rights can be extended to these workers. But what kind of solution is it? It always has these unintended consequences. And that's why I think we should be very humble and very critical at the same time towards such well-meant policies. Again, I think it's to be supported that amnesty and legalization take place. But in a country like Italy, or if it happened in Germany, it would not be a kind of a very far-reaching solution, because we have seen in countries like Italy, for example, but also in other European countries, many waves of legalization. And again, the same issues of undocumented workers and their rightlessness has come up. So in a way, there is a manifest function to grant rights, but the latent function is to avoid devising more comprehensive immigration policies. And I think that's the point. I think when we talk about public policies, and Mr. Nair has done that admirably, then the question for me is always, what kind of unintended effects do these policies have? I mean, there's not only a one-size-fits-all policy, there's also no panacea for these policies. And that's why I think we need to be, when we talk about policy recommendations here, especially those like me who are academic armchair, so to speak, policy advisors, should be very careful, because we don't know about the unintended consequences of these policies.
Thank you for that. I'd just like to actually bring in Mr. Boakie Yaudom in terms of your raising the issue of forced labor, because I feel like there's many ways that we can describe these different categories. But I wanted to hear just if you wanted to weigh in, and also then hear back from Mr. Bilongo, who was referenced by Professor Feist. But I wanted to just get a quick check-in from you. Are we missing something here in the discussion by trying to, in some ways, maybe be overly concerned about the unintended consequences of some of these things, which I think is an important thing to raise. But I just wanted to check in with you, given what you were saying earlier.
Thank you, Professor. I think I also did mention about generations of forced migration in terms of the movement of Africans to the Western world during the slavery era, and some of the consequences that's ensued after that in terms of systemic racism and injustice that is we're currently seeing in the United States, police brutalities. But obviously, forced migration also would include people who are through means and circumstances beyond their control, be it economic or political, have been displaced and on the move and helping to maybe seek asylum in certain countries. I do believe that there should be some consideration to the circumstances surrounding the forced migration, and that I think cases should be looked at based on their merit. So on a case-by-case basis. In terms of unintended consequences, we are currently in a global pandemic, and I think we all agree that half of the global workforce are migrants. And even in the United States, there's been talk of food security, where we have lots of undocumented migrants that are working, to make sure that Americans have food on the table day in, day out. So with stuff like a global pandemic going on, I think that we need to be humbled and recognize the fact that we need each other, and that people need to be secured if we need to be secured and expect our daily meal on our table. We need to make sure that those people who are making that possible are secured in what they are doing and not being treated unfairly, not being having their human rights abused simply because of their status. I think and believe that such people do need some security in terms of their status and also in terms of their economic base to ensure the food security of all. Thank you.
Thank you very much. If we can, I'll now turn to Mr. Belongo. If there's anything you wanted to add to what Professor Feist was saying, building on Professor Walton and Boakie Yadom.
Yes, thank you, Professor. Well, I believe that solidarity should not be an empty word. No, we have to give stuff to solidarity, and solidarity in times of coronavirus outbreak means protecting the population, not protecting only the citizens. There's a huge difference between protecting the entire population and protecting the citizens. And if the direction is that of protecting the population, the entire population, in that case, even undocumented migrants, every migrant is included in the population. And solidarity needs that more attention, social attention, health attention should be given and granted to those undocumented migrants. So, and the documented ones are free. They are free to go back home if they desire to. They are free to get back to their home countries if they desire to. But we also what happened in many countries. I'm from Cameroon, for instance, and migrants from Cameroon during the up to now, when they go back home, or other countries such as Morocco, Tunisia. I mean, most of the countries, if migrants go back home, they have to obey to coercive confinement, quarantine. There's nothing to do about it. Now, this seems to be engine for the countries, those who contribute to the GDP through their remittances. They are considered as dangerous for the society, dangerous for the community, dangerous for the village. I heard one of the pilots saying that migrant going back home does not only go back to his country, but he goes back to his district and goes back to his village. In this case, they tend to be dangerous for their villages, their local communities, their district. So, and based on that, solidarity should be filled with substance, and the only substance in the presence of undocumented migrants is that of granting documents. Yes, I saw a question that was asking whether this amnesty, for instance, is the best solution on the long run. Yes, it might not be the best solution, but it is a solution because we have no further solution. You know, it is exactly like what we have with the coronavirus outbreak now, without in the absence of any other solution. The only way out was the policy of staying at home. There was no other solution. That was the best solution, and we all had to obey. So, in the presence of thousands and thousands of undocumented migrants, what should we do? Leave them continue living in the dwellings, in the townships? No. The only way out is to grant them documents so that they can be properly taken care of in terms of medical assistance if many of them happen to be positive to this disease, for instance. And I think that is our conviction, and that's the way out. The only thing is not that of saying they have to go back to their countries. No. It wouldn't be possible. It wouldn't be possible. Many boundaries are still off now. No way to enter. And we believe as they contribute as well, in keeping the countries, I mean, the host countries, keeping them safe from, I mean, in terms of food security, they have to be recognized as workers, as people, and they have to be granted documents. That's the only way out.
Thank you. I want to give, we have about 12 minutes left, and I wanted to give Professor Singh and Mr. Nair an opportunity also to weigh in on what the conversation is going. I know that there are a number of questions in the chat, which hopefully we will be able to access at the end of this with a recording. You can also copy paste it if you want to respond to those individual questions, but I also don't want to deviate too much from what we're talking about here specifically. So let's go in the order of Professor Kumar, if you would go first, and then we'll turn things over to Mr. Nair, and then perhaps just some closing remarks. You need to unmute.
Thank you. What I have actually gone through all the questions which have been raised, and so I would also try to give answers to some of the questions which are addressed to me. The government is, of course, preparing a arrival database of migrants, but we have some idea about the migrants who are coming back, from which country they are coming, and with what kind of a background. But as I said, the problem is of unemployment. This is at present one of the biggest problems in India, and it has nothing to do with COVID. COVID has just increased that unemployment. But this is a continuing problem, and there is say explanation of why unemployment is so high, how the government policies have supported the corporates more, and it's more supply-driven kind of a government policy rather than increasing the demand. So on the demand side, government is not working. All these issues are there, and it's not the time actually to discuss that in detail. Mere skill mapping, I think, is not adequate. The government has to think about employment programs. And at this stage, I think there are two important things. One is expansion of work-related program. That's one. And the second is also income support to families. These two, I think the government has to emphasize on. Then I will come to the third one, is the food security aspect. I know that, say, those who are coming from, say, other countries, and the wages which are so low in India, so somebody participates in the rural works program and finds that the wages are just now have been raised just 20 rupees, and it is now around 200 rupees. 200 rupees will be some $2.50 or so. So that's not enough, and that doesn't meet the expectations of people. But at the same time, it's also not the minimum wages in this country. So what the government has to do is not just the expansion of employment programs, but also improving the quality of the employment program. And one way of improving the quality of employment program is to actually to raise the wages, to at least make it minimum wages in India. So I think then it will actually motivate people to engage in, if there is a work opportunity, to then engage in the works program. And as I said, works program have to be also in urban areas, and this is long, say, it's a demand of civil society groups, particularly Right to Food and Right to Work campaigns. Then the food security program, which at least ensures that people do not go hungry. And as we know, India suffers from chronic hunger problem, also massive malnutrition problem. So at this stage, what is important is to ensure that the food delivery is timely through the public distribution system, and all those who have been left out, and particularly those who are affected because of the biometric system, I said they are included. So for the time being, like for the first month, the government did away with the biometric system. If that can be extended, and also on a war footing basis, if they can include people, those who are left out. Now, one more thing which is very important at this stage, and which is also the requirements of the migrants who are coming from abroad, is the quality of quarantine. I think Professor Watson has already, Walton has spoken about that. So quality of quarantine, and also the public health services. Except Kerala and a few states, the public health services are in very bad shape. And at this stage, the way the private hospitals are exploiting people, it's so difficult for any common man, even general middle class people, to, if you have COVID, say, infection, to go to any private hospital. And most of the beds are now in these private hospitals. They ask you for 5 lakh, 10 lakh rupees as deposit in the beginning. So if we have to fight with this, the pandemic, and ensure that people are not dying, and ensure that they are not affected by mass malnutrition, and to ensure that they have some sustenance. So at least these things have to be done by the state, and these can't be done by any civil society groups. Or even when I'm saying state, I include the local bodies, but the local bodies depend for resources on the central government and the state governments, and the local bodies also suffer from all those biases, the power structure, the way it is structured. So all those also keep in the local bodies. So I just can't romanticize local bodies. We have to be very clear about the ground realities, even in the local self-government. Thank you.
Thank you, Professor Singh. Let us go to Mr. Nair for any further thoughts on the conversation. And then what I'd like to do is then go around for all the panelists to take 30 seconds to just summarize some final thoughts. And forgive me for cutting you short in terms of time. I know that there's much to be discussed and continue to elaborate on. Mr. Nair.
Thank you, Professor Ali. Now, this is I'm glad that there has been a whole range of aspects that have been touched upon. So I will not perhaps overdo it, but I would look at it from 3 different elements. Reintegration, and I want to focus here on reintegration, because I think there is constantly this confusion between integration and reintegration. Think about this. Even before people have started coming back, there is a whole group of people who had their mindset on leaving. So in Pakistan, there were about 60,000 people who had got their visas and were ready to leave when COVID struck. The same in Bangladesh, a big number in India, and so on. Now, these people, when you get your visa on your passport and you're ready to leave the country, there is no question asked about a life back home. You know, it is about wanting to go and earn your livelihood in the country of destination where you plan to. Now, for these people, really, it's a huge drawback for wanting to do that, and now it's going to backfire on their perspectives, on their larger perspectives, both socially and economically. So with that in mind, then it's important to recognize that any reintegration has to be both at the social and at the economic level. How many people come back wondering whether they're going to be treated as the carriers of infection and therefore stigmatized and not being able to reintegrate properly in their communities? That is a big issue, and therefore there needs to be strong awareness generation in our respective communities. Now, I understand what Professor Pushpendra says with regards to not romanticizing local governments and so on, but there is a role that they have to play, and we have to empower these local authorities to play that role in spreading information in the right way and the right form. When we talk about migrant workers, they're not just anybody. You know, whether it's an irregular migrant worker or a regular, they have skills, they have experiences, they have life experiences that people can learn from, that people, that governments, that countries, that communities can gain from. So within those experiences and those skills, how do we then recognize prior learning? Now, I agree with Professor Margaret Walton Roberts. This is certainly an issue when it comes to people who come back, their degrees, students now, not the degrees not recognized in India. Well, this is also the issue of people who do go from here with an MBBS degree, a medical doctor who ends up working as a taxi driver in the country of destination. So recognition of prior learning, upskilling, reskilling, issues pertaining to all aspects of skills. How do they move in the first place in terms of ensuring fair recruitment, and that when they come back, that these recruitment charges that they have paid do not lead them to further indebtedness, are all important aspects that need to be considered for reintegration. And I'll conclude with one final point, and that is this. I agree with Dr. Feist. Sometimes policies are not everything, but policies also leave a benchmark for governments to follow. Even in the work in terms of producing a policy has a lot of effort that goes into it. There's already a coordination that takes place when governments produce policies. Within those policies, you have acts, you have laws, and those acts and laws are important. One of the big issues that we are seeing is dilution of laws, the weakening of labor laws, the weakening of labor standards, and that shouldn't be allowed to happen. Because if that happens, that also leads to a bigger issue of a lack or a weakened regional coordination mechanism. And the regional coordination is going to be crucial for reintegration. Thank you.
Thank you very much. I see that there are more questions that came in, some hands that are up. We are actually at the close of the hour-and-a-half panel discussion, but I'd like to ask our various panelists to take just a little something, a little 20 to 30 seconds to comment and summarize if there's, so we'll begin with Professor Feist.
I feel very much enriched by this discussion, and thanks to the speakers and the questions. And one of the things I take away from this discussion is the term that when we talk about integration, we should really always ask integration into what? Because it's integration into families, you see it in remittances, it's integration in civil society organizations, I mean unions where you see it solidarity, it's integration in organizations like companies like the nursing homes Margaret Walton Roberts mentioned, and it's integration into a state. And I do think that when we talk about return, we should not simply talk about reintegration, because return always means that you've always been integrated into some kind of social unit. And I think they're multi-scalar. And the multiplicity and diversity of these social units into which we all, not only migrants, are embedded in, I think that's key to understanding the success of return. Thank you.
Thank you very much. Professor Walton Roberts, please.
Yes, thank you. This has been a really rich discussion, and I'm most appreciative to those in the other members who have posted questions. I've been looking at the questions and trying to keep tabs. And I would just add, I mean, there have been a number of questions posed around issues of what Professor Pushpendra Kumar Singh has discussed. And I do wholeheartedly agree with his comments that we do need to see central governments invest in works programs. I'm also familiar with the MG Narega program and would concur that an urban example would also be useful. I would highlight, though, that there are some interesting research on that program in terms of the gender dimensions, and that we need to be conscious of how to incorporate women and other marginalized groups into those opportunities. And I wouldn't romanticize that level, that scale, but it is the closest to the community. And to be honest, even though research has indicated that program has significant leakage, there's always the concern about corruption. Corruption is everywhere. So why do we allow corruption at the highest scales to go on, and then we want to end the program because there's corruption in the scales closest to where people are? So there is a significant amount of work to be done to facilitate the return and integration of migrant workers, and hopefully what we can see is some advocacy and engagement to seriously look at the policy deficiencies that have emerged in the inability of states to understand what's happening and to find adequate solutions to even providing the barest minimum of livelihood protections at this time. Thank you.
Thank you, Professor Walton. We'll go to Mr. Belongo.
Well, thank you, thank you. I will just say this. I'm afraid that the return of migrants would sound like a failure, you know, during the coronavirus and even after the coronavirus outbreak. And that's why, being a migrant myself, I believe that every possible thing should be done in such a way that they could continue to live legally in their host country, because from their former position, I mean, people contributing to the welfare of their families, supporting their families, and just getting back home without anything, I'm afraid it might sound like a failure. And those migrants would be considered pariahs to the society. And maybe the best thing is to give them the opportunity and the possibility to continue to live in their home countries in legalized positions. Thank you.
Great. Thank you very much. Mr. Bouaké Iyadoun.
Thank you, and thank you to my fellow speakers. I think this discussion has been very rich. My closing thoughts, I mean, there was a question on the, in the chats about going forward, what we anticipate in terms of irregular migration through the deserts, through the Mediterranean. And my comments will be that there needs to be more at the countries of origin. And that's what my organization, we've been trying to advocate for more economic initiatives in the communities that are more endemic to go on such migration trips. Another thing will also be for to advocate for access to information for migrant workers abroad. I think that's one very key thing, that you need timely and accurate access to information to make decisions that will enrich your life in terms of even return or reintegration. So thank you very much, everyone.
Thank you. Mr. Nair, please.
Thank you, Professor Ali. How do I conclude a session so rich? So I'll take a leaf out of my own personal life. My father was a migrant worker in the Middle East, which is where I grew up, and which is where he came back from 35 years after he left this country. When he came back voluntarily. He came back happy. He had retired from his work. He had built a house for himself. He had some bank savings. He could take care of his family and his only child, i.e. me. I was well settled. He still didn't know how to come back and live a life in the country that he called home, right? Therefore, any of these conversations that we are having, if we don't keep it centered on that worker, whether it's a man or a woman, a domestic worker, a construction worker, or a CEO, it doesn't matter. The priority should be focusing it and centering it around migrant workers. Let them be the center around which we have these discussions. That'll help us to only make it much more productive. Thank you.
Very much. And finally, Professor Pushpendra.
Thank you, Professor Ali. I would say that the government should bring back migrants, those who want to come back, and they had the earlier priority of bringing back on students, those who are on short-term visa or ill or pregnant women. Now they should see that the workers, those who want to come back or those who are in difficult circumstances, and even if they don't have money to pay for their ticket, they are brought back. The government should also share data about how many people have actually registered for coming back. And I would also say that we need to also focus on the plight of migrants in destination countries, and countries, sending countries, collectively should also negotiate with the receiving countries so that there is support to our migrants. Then I would also say that, see, you look at the news which have come from Singapore, for example. Gulf we all know, but then the workers from Bangladesh or workers from India, Then I would say that we need to focus, because I'm talking about only the workers. We need to focus about work and quality of work. And finally, I have nothing against the local self-government, and I'm all in favor of empowering them because they are closest to people. But what I was saying that we need to be very, very cautious that the pre-existing inequalities and discriminations and all fault lines are also addressed. Thank you.
Well, we've come to the end of this discussion, and I want to thank the panelists very much for this. There's many thanks that are appearing in the chat, and also questions that have not been answered. I know that we've been trying to respond to as many as possible. Thank you for those who are participating as listeners and who've submitted questions and comments. I'm very grateful also to Dr. Sen and Dr. Agarwal and the whole GRFD team for organizing this session. And I just wanted to say, as an American here of Indian heritage, my father's from India, my mother is from Peru, that I very much appreciated that Mr. Bwakwe Yadom was raising the issue of what's going on here in the United States. And I feel very inspired by the support internationally that has been offered to my fellow Americans here, Black Americans in particular, who have been struggling against this kind of oppression. And the great irony is that many of the police force are themselves African Americans, and so it's a very complicated situation that we are dealing with in the United States that goes back to slave patrols and oppression of the state. So I find that this discussion of looking at the most vulnerable people is very important. There are many struggles to be had, many challenges that we face internationally, globally. And I just wanted to express my sincere thanks and gratitude for those of you who've been in alliance with our efforts here to protest the victimization of Black people under the police. So thank you all very much. And again, I hope that we continue these kinds of discussions and we use the technology of Zoom. And I hope that you all have a good rest of the day wherever you are in the world. Have a good one. Take care, Bip.
Thank you, sir. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you all.
Dr. Pandey,
Thank you. Thank you all. It's a wonderful program.
Thank you.
Well, good
Stay
evening.
safe and blessed.
Am I?
There's a comment.
Yeah, this is just a
Thank
vote
you,
of
everyone.
thanks. I would like to. Can I speak?
It was wonderful.
Am I audible?
Yes.
Yes, you are audible. What is it that
Okay.
you would like to say?
Okay, good evening, everyone. I'm Amba Pandey, and it is my privilege to propose vote of thanks on behalf of GRFDT, which is emerging as one of the most prominent forums in India on diaspora and migration. To begin with, I would like to thank Professor Omar H. Ali for moderating the session. Thank you, Professor Ali, for such a well-managed panel discussion. I would also like to express deep sense of appreciation for our distinguished panelists for an extremely enlightening talk. Thank you, Professor Thomas Feist, Professor Margaret Walton, Professor Pushpendra Singh, Professor Bilango, Mr. Sabari Nair, and Mr. Kwado for such an insightful and wide-ranging coverage of issues on integration and return. I also take this opportunity to place my heartfelt gratitude to esteemed experts who joined us from across the world, and the list is so long that I won't be able to mention their names here. Thank you everyone for constantly encouraging the team GRFDT through your presence. Our appreciation towards you is beyond words. Last but not the least, my deep thanks and appreciation to all the participants from across the world who are regular in these sessions. Thank you very much. We really appreciate your cooperation and participation. Thank you all. Thank you very much. Now I would like to invite Rakesh ji for announcing the next session.
This will be the another panel discussion on 16th June. That will be on, will there be brain drain again post COVID-19? So we look forward to your participation again, and thank you. Goodbye.
Bye-bye.
Bye. Bye.
Bye.